Hello everyone. Let us talk about present scenario of competitive examinations in India. Let us see that how the pattern of examinations has changed over the period of 10 years. 10 years before, the exam used to be paper-based test. But then, slowly and gradually, it became a mixed approach, which means in some places, paper-based test was being conducted and in some places, it was computer-based test. But if I talk about present scenario, now it is completely computer-based test. Talking about competition. So 10 years before, there was less competition. There were 10 to 15 candidates used to be there per vacancy, but now it is highly competitive and there are around 50 to 100 candidates per vacancy. The ratio of application and vacancies is now changed. Now the ratio is around 1:15. Talking about cutoff scores. 10 years before, the cutoff score was also low. The range was 55 to 60%, but now there are high cutoff scores and the range is above 70%. The percentage of aptitude-based questions is also increased now. Earlier, 10 years before, there were no or minimal aptitude-based questions were there. But now it has increased up to 10 to 20%. No image-based questions were asked. But now, image-based questions are common. So this is how the pattern of examination has changed. Let us have a look at the different examination patterns. So if we look at the AIIMS, New Delhi and other 6 AIIMS, 10% MCQs are from GK, arithmetic ability, reasoning and aptitude. Whereas in PGI and JIPMER, no questions are asked from GK, arithmetic ability, reasoning and aptitude. ESIC, there are 25 questions from GK, arithmetic ability, reasoning and aptitude. And in RRB also, there are 30 questions from these fields. In DSSB, there are 100 questions from GK, arithmetic ability, reasoning and aptitude. And in RML Delhi, 25 questions are asked from these fields. Let us walk through the journey of Targethigh from 1st to 6th edition. The first edition of Targethigh came after a lot of brainstorming and careful anticipation with futuristic approach. Image-based questions were introduced in this first edition and CD-ROM was also provided because CBT was introduced, and so as to make everyone familiar with the approach, this feature was introduced. Then came second edition of the book, and to match with the level of high difficulty of the examination, new questions with high difficulty index were added. Synopsis was revised as per the need. Then came the third edition of the book, and this time it was launched with the tagline of One Nation, One Book, because by this time Targethigh had become one of the top nursing competitive examinations book in India. For the very first time, digital support was provided in the form of application support. Then came fourth edition of the book, and in this edition, nursing procedures were added for skill-based test. Application support to Nursing Next support was provided, and integrated approach was used for anatomy and physiology and medical surgical nursing. Synopsis was revised furthermore with 150 new topics. Then came fifth edition of the book, where video-based questions with application support were introduced. Integrated approach was used in medical surgical nursing, and 17 new chapters were added, and largest collection of previous year papers with application support was given. Then came 6th edition or the current edition. Now in this, we have provided an integrated approach of a supplementary booklet with digital support in which you will get the access of the book on the go. In this, Emily, the digital educator, is also introduced for better query response, and golden points with the approach of listen and recall in the form of podcast are also provided because almost 60% questions they come from golden points. You will be getting monthly updates with Target High Digital Lite. There are 100 plus previous year papers, mock test, subject-wise test, and you will be getting monthly update. Layout also changed with important notes and previous questions. Now let us learn that how to prepare effectively with Targethigh. Now there are some preparation strategies. Very first is time management. Plan out a timetable which is feasible. Utilize your time wisely. Challenge yourself. Devise easy techniques such as mnemonics to remember, audio-visual aids to enhance memory. Strengthen your basic understandings of the subject and do not leave anything for last minute. Prepare short notes of your own for revision. Consistent practice and stick to the schedule. Now, where to start? So, you have to start with synopsis. Read and reinforce and revise with the help of golden points. And begin with basic medical subjects. Review 100 questions a day. Use digital support. So Targethigh Lite is completely free. You can review old papers on the move. You can update yourself with recent uploads in the application, and you can check for errata updates in the application. Practice at least 50 to 100 questions per day during preparation stage. Now you can strengthen your preparation strategies by creating your own mnemonics while preparing. Follow chronological sequence when learning years and events. Try to connect the years with significant events in your life. Highlight the MCQs that you have marked wrong during the first review. Revise and reinforce the highlighted questions during revision and last-minute review. Analyze the reason behind your mistakes while reviewing questions and get the basics right. Tips and tricks in answering questions. Pay attention to key terms and phrases. Look for the adjectives like most, primary, first, initial, least, etc. Eliminate false answers first. Be alert for a question that requires you to identify which answer is incorrect. Example, keywords: except, inappropriate, excludes. Be careful with double negatives. Example, all of the following interventions are inappropriate for a patient with pneumonia except. Evaluate the answers in relation to the stem, not to other options. Look for the most comprehensive answer. For example, provide the patient calm and quiet environment versus provide the patient calm, quiet and comfortable environment. Priority decision making. Most life-threatening conditions follow ABC principle except CPR. First priority nursing intervention. Example, suction before medication. Move from actual to potential problems and follow the steps of nursing process, and they are assessment, planning, implementation, evaluation, safety issue. Example, monitoring oxygen level for neonate versus adult. Here, one example is also provided. A patient with multiple injuries after a road traffic accident is rushed to the emergency ward. Which of the following assessment finding requires immediate intervention? Minimize the risk of errors. Best and most tested way to improve success ratio is to study carefully before the exam. There is no good alternative for knowing the right answer. However, there are certain methods that can be helpful in minimizing risk of errors in exams while answering difficult questions. Try to presume the right answer before you are distracted by seeing the options. Then read the options or uncover the options. If you see your anticipated response, mark it and then review other options and be sure none of the other responses is better than the marked one. If you do not see the anticipated response, follow any of the following strategy to solve the question. Minimize the risk of errors. Distractors that use absolute words such as never or always versus distractors that use conditional words like probably or usually. All of the above is often a correct response if more than one distractor is probably correct or similar. None of the above is usually an incorrect response, but this is less reliable than the all of the above rule. The longest response among distractors is often the correct one, but do not use this strategy blindly. Look for grammatical clues. Look for verbal associations. A response that repeats keywords which are in the stem is likely to be correct. Consider negative markings and be judicious in using these techniques. If two options are exactly or almost opposite to each other, then most probably any one of these two is the correct answer. If two options are very or nearly similar, then both are not the correct answer. If you cannot answer a question within a minute or less, skip it and plan to come back later. Reserve some time to check your answer sheet for completeness before you hand over the answer sheet. Finally, you can do it.